Do you think we treat too many adults with medication?
That is very far from the truth. We know that the prevalence of ADHD in adulthood, measured in the absolutely most rigorous way possible, meaning that they had ADHD as children. They continue to have ADHD. They have all the functional impairment of ADHD. They never had a time where they didn't have ADHD, and they have ADHD by child criteria now is 4.4%. So the prevalence is high. And yet, in a paper by Steve Ferrone, when he surveyed those adults with ADHD and primary care physicians, a tiny fraction of those people have been either diagnosed or received adequate treatment. And that's despite the fact that we have good treatment. I think that there are many things about ADHD that have left it orphaned. Adult ADHD is an orphan because it's a childhood disorder in a grown-up person. The people with the mandate to provide the service do not understand the condition, and they don't understand the other disorders that are also neurodevelopmental disorders like autism or learning disability or Tourette syndrome that go along with it. As a result, no one has taken responsibility. The child clinicians do not have the mandate to treat the adults. The adult clinicians do not see the disorder, and their procedures make it invisible. If you see an adult alone with no collateral information, no background, no school report cards, no developmental history, you cannot see his ADHD. He will come in complaining of depression or anxiety or getting into trouble or his wife leaving, but you will not see the ADHD. And so even now, we have not successfully figured out how to translate the large body of science we have that demonstrates that ADHD in adults is chronic, it's impairing, and it's common. Most of all, it's treatable. That means that if we treated ADHD in adults, there would be less people in our prisons, and we've shown that in research. There would be less smoking. There would be less drug abuse. There would be more people who had graduated college. There would be less unemployment and misemployment. So well beyond the burden of suffering, we would save enormous social costs. And in addition to that, we would save tremendous suffering, not just for the patient and the family, but for the victims of ADHD, the victim of the car crash, the victim who can't afford specialized tutoring or other educational availability because the ADHD child in the classroom is taking all the teacher resources. We would all benefit if we could use this therapeutic opportunity.